How has cancer classification and diagnosis evolved historically? Imagine a time when doctors could only tell if someone had cancer by looking at a tumor or feeling a lump. That was how it all started. For thousands of years, cancer was identified mainly through visible signs and symptoms. Ancient texts from around 3,000 years before the Common Era described tumors and treatments like cauterization, which used heat to burn away cancerous tissue. The word cancer itself comes from the Greek doctor Hippocrates around 400 years before the Common Era. He called tumors karkinos, meaning crab, because of how the tumors looked and spread. Early ideas about cancer thought it was caused by an imbalance of bodily fluids, a theory that lasted for many centuries. In the 1700s and 1800s, doctors began to link environmental factors to cancer. For example, in 1775, Percival Pott noticed chimney sweeps had higher rates of scrotal cancer because of exposure to soot. During this time, surgery improved with the invention of anesthesia in the mid-1800s, making it easier to remove larger tumors. The discovery of X-ray technology in 1895 opened new doors for diagnosing and treating cancer with radiation. Moving into the 20th century, scientists started examining tissues under microscopes. This allowed doctors to see the different types of cancer cells and distinguish between them. The development of the Pap smear in the 1940s made it possible to detect cervical cancer early by examining cells from the cervix. Chemotherapy was also developed during this time, initially from chemicals used in warfare that affected white blood cells. This led to treatments for leukemia and other cancers. By the 1960s and 70s, cancer diagnosis became more precise with the help of genetic and molecular research. Scientists found that chromosome abnormalities were linked to cancer. Imaging tools like computed tomography scans helped locate and stage tumors more accurately. The 1971 passage of the National Cancer Act increased funding for research, speeding up discoveries in cancer biology. In recent decades, the focus shifted to understanding the genetic makeup of tumors. The Cancer Genome Atlas, launched in 2006, mapped genetic mutations across many cancer types. This helped doctors classify cancers based on their genetic profiles, not just where they are in the body. As a result, diagnosis is now more detailed and personalized. Doctors can analyze genetic markers to see how aggressive a cancer might be and choose treatments that target specific mutations. Early detection tools and advanced imaging also help catch cancers sooner, improving chances of successful treatment. Overall, cancer classification and diagnosis have gone from simple visual checks to detailed genetic and molecular analysis. This progress means that people living with cancer now receive more accurate diagnoses and tailored treatments, giving them better chances for recovery and quality of life.